the tail of feline panleucopenia virus, Mr. FPV for short. So Mr. FPV's scientific name is feline panleucopenia virus, which means reduction in all white blood cells. Mr. FPV is a part of the parvovirus family, a group of viruses known for being small. He is also sometimes called feline parvovirus. Mr. FPV likes to infect rapidly replicating cells. He is very small and lacks DNA polymerase. He is a single-stranded DNA, so vaccines are very effective against him. And he is non-enveloped, tough, and can survive in the environment for up to a year. So who is Mr. FPV interested in? Dogs? Nope, cats. It's a match. So Mr. FPV can infect all cats, but commonly infects unvaccinated cats, and particularly young cats, as they have a lot of rapidly dividing cells and a weak immune system. Transmission starts with an infected cat. They shed FPV mostly in their feces, but also other bodily fluids, which leads to environmental contamination. Then, Mr. FPV goes from the feces or fomites to healthy cats via oronasal transmission. This means catteries and vet hospitals are highly prone to environmental contamination. Mr. FPV can also be transmitted vertically via transplacental pathways from an infected queen to embryo. Pathogenesis usually starts with Mr. FPV entering the victim's mouth and going to the oropharyngeal lymphoid tissue. It takes between 2 to 10 days from this initial exposure to see clinical signs. Now he looks for actively dividing cells which have transferrin receptors, such as macrophages and germinal center cells. Then, Mr. FPV binds to the TFR receptor, triggering endocytosis. Mr. FPV makes his way to the nucleus, where he waits until the cell enters synthesis phase. He then hijacks synthetic machinery, such as DNA polymerase, to form baby FPV virions. This leads to serious FPV replication, but leads to apoptosis. Mr. FPV then travels to other organs via bloodstream. He goes to various lymphoid tissues, causing widespread immunosuppression. Mr. FPV also infects progenitor cells and bone marrow, causing panleukopenia and erythropenia. In the small intestine, Mr. FPV infects crypt epithelium, that are enterocyte progenitor cells. This causes long-term damage of the villi, leading to severe dehydration, enteritis, and diarrhea. Often we see melena and secondary bacterial infection. When cats are infected transplacentally in late gestation and 2 weeks after birth, FVP can cause cerebellar hypoplasia in kittens. Additionally, Mr. FPV can infect the fetal retina, causing dysplasia, atrophy, and blindness. Mr. FPV causes severe, widespread disease that can quickly lead to death, particularly in early gestation and neonatal cats. Most FPV infections are subclinical, but cats can have signs of panleukopenia, enteritis, pyrexia, and lethargy. Kittens may appear wobbly due to cerebellum hypoplasia or have retinal issues. Diagnosis involves detection of clinical signs. This can be supported by panleukopenia and blood results and a positive SNAP fecal test. However, Mr. FPV is intermittently shed, so a negative SNAP test is not always conclusive. If suspecting a false negative, PCR tests can be performed with higher sensitivity. Histology of small intestines can also support FPV diagnosis, and new strategies involve intestinal ultrasonography. There are no specific FPV antivirals, so treatment is symptomatic, such as fluids therapy, antiemetics, antibiotics, and antihelminthics. There's promising research for FPV antibodies and immunomodulator treatment options in the future. Despite poor prognosis with FPV, there is a highly effective vaccine. Accordingly, vaccination, particularly of kittens, is crucial. Live attenuated vaccines are used for FPV, with the first given at 6 to 8 weeks and the second at 10 to 12 weeks. The last vaccine should be administered in week 16 to ensure coverage, as maternal antibodies are present up to 16 weeks of age that can interfere with the vaccine. There's a window of susceptibility between 8 to 16 weeks where kittens should be kept indoors and away from potential vectors. Adult cats that haven't been vaccinated, such as strays, only need to receive 2 vaccines 3 to 4 weeks apart. Cats should then be vaccinated annually to boost immunity. Prevention also involves cleaning environments and isolating infected animals. So get your cat vaccinated and swipe no on Mr. FPV.